This twisted line that you can see on the ECG strip is an unpredictable rhythm and is deadly if not treated properly. This rhythm is a polymorphic ventricular tachycardia known as torsades de pointes. So let's understand the basic mechanism behind it. Hello everyone, welcome to the Rhythm Files episode 7. So as you can see here, multiple foci are getting activated in the setting of early after depolarization. So this is basically a trigger that initiates another action potential before the first one is even complete. Now when this happens, there is a rhythmic activation of the foci in the ventricle. So even the normal myocardial tissue can become partially activated or may become fully activated in this setting. Now, because there are different points of activation in torsades de pointes, therefore the QRS impulse, the direction of the QRS impulse will be different with each point of focus. To understand this better, let's arrange these vectors, the direction of the QRS impulse, in such a manner that they are originating from a single point. So this is what we precisely get when they are arranged like that. Now observe the arrow that is pointing currently at A and then imagine it to point towards H, G, F and E and so on in a sequence. Once you do that, you can plot it on an XY axis. So here we can see that we get a wave which is having a variable amplitude. Now after superimposing this with the ECG strip that we have, you can clearly observe that the amplitude of the ECG strip is varying with the direction of the QRS impulse. So as the arrow is moving in that fashion, the amplitude of the QRS keeps on changing. So this constitutes the mechanism. Now let's take a look at the management. So if the patient is hemodynamically unstable, we go for defibrillation. If he is stable, we administer IV magnesium sulfate at an initial dose of 2 gram IV over 10 to 15 minutes. So this helps suppress the early after depolarizations and terminates the TDP. Electrolyte repletion of potassium, magnesium and calcium is important. Chronic hypoxia or hypothyroidism is to be managed. And in persistent cases, AICD insertion is to be done. Thank you. Please like and follow and comment down the drugs that prolong QT interval.